hearing about the refraction, I will just go through what is the spectacle frame and lens available in the market, what is the technology, what are the innovations. So now everything is a lifestyle dispensing. That all depends upon the self-image, occupation, leisure activities, and personal values of the individual. So as far as the personal visual correction is concerned, you have a vital role here because you are an expert to recommend the right spectacle and lens to the patient. So I will just go through what are the things available in the market. So how you can satisfy the patients. Everybody prefer for the best. Money, nowadays nobody is not much bothered. So they have a better visual experience. Then they will come back with their relatives or friends. So what are the eyeglass and frames available in the market? So what is a single vision? So single vision glasses are mainly used for refractive errors, myopia, presbyopia, etc. Then reading glasses, bifocals, multifocals, that is progressives, that is for the refractive presbyopia, and sunglasses with power, and vocational spectacles. So these are the vocational glasses available. These are the half-eye reading, then safety spectacles, swimming goggles, sports glasses, driving mask, computer glass, welding glass, etc. So frame rate is half-eye reading. It's a very cheap, only 150 to 200 rupees. Then full rim, 360 degree, there's a frame. Rimless or three pieces with a nose bridge. Then supra frame, upper part there is a frame, lower part there is only thread only, and clip-on lenses for computer use, etc. Then the frame materials, time old material was metal, but only problem, corrosion is the problem. Now the younger generation use the shell or carbon, they call it plastic frames. And the older people use the titanium, that's the most safe and everything. Stainless steel and aluminum is out of market, and gold nobody can afford nowadays. And lens varieties, single vision lenses for myopia and hypermetropia, then bifocals. If the upper part is round, it is called a cryptop. If the upper part is flat, it is called a D bifocal. Trifocal is now out of market. It has been taken by multifocal or progressive lenses. And lens material, the time old material was crown glass, highly transparent and scratch resistant. Only problem, weight is the problem. Now it is going out of market. It is taken by Columbia resin 39. So that is comparatively cheaper and thinner, and weight also less. But it CR39 also now coming to replace by polycarbonate, that is thin, light, strong, and thermoplastic. Only problem, scratch resistant coating is required, and it is little more expensive. And if you want a high power, high myopia, you go for a high index lens more than 1.56 diopter refractive index. And if you have day and night lenses, photochromic option is also available. And lens material, the properties are the refractive index, specific gravity, Abbe value, the quality of reflection, and UV protection. And based on all these qualities, the best lens now available in the market is polycarbonate with 1.58 refractive index. And nowadays, MR6, MR7, MR8 is also available. That is also super lenses. The plastic lenses, also CR39, this is safer than glass, but it can break also, and the photochromic option also available. It is not ideal for the three-piece frame because it can break. I will show you later. Photochromic lens means it can change the color for UV protection. Previously, it is called a day and night lenses for the ordinary glasses, and for the CR39 and polycarbonate, it is called a transition series of lens. And polycarbonate lens, as I told you, it is unbreakable. It is a bulletproof plastic lenses that is ideal for children, and UV protection is also available. The aeroplane and bullet car, they are using that glass. And this is the, you can see, it's a CR39 ordinary plastic lenses, which is breaking when 500 gram weight is dropped. But if you give a polycarbonate or trilogy lens, you can see that the 500 gram is dropped, it is not breaking. So if you, it is ideal lens for children, polycarbonate. So S-free high index lens is also available for chromatic aberration and everything. It is 46% thinner and 46% lighter than glasses. You can, your facial expression and appearance also will increase. It become thinner by 46%. Lot of lens treatment is available like UV coating, tinting, anti-reflective coating, scratch resisting coating, transition of photochromic choice also available. Why you should have a protection of all these things? Because there is a UV light C, B, and A. UVC will be protected by ozone layer of the atmosphere. UVB will be falling on the cornea, and UVA will come to the lens and can produce a cataract. So if you have a UV protection coating, it will prevent cataract, pterygium formation, ARMD, etc. So on the base lens, you can have a hard coating, you have a UV coating, you have an anti-reflection coating of 7 colors, VIBGEOR, and over that you have a hydrophobic coating also possible. So what is tinting? Tinting is comparatively cheaper. The dye uses melanin, sp2, and brown tint. So you dip the CR39 or polycarbonate in the solution for some time, it will give a color. Only problem, after a few months it will fade away, but comparatively cheaper, only 200 rupees. What is scratch resistant coating? That is a protection for CR39. It's not a 100% protection, but it gives some protection. Reflection of the lens is a main problem while reading or while driving. So for that you should have a AR coating or anti-reflection coating. With that, 99.6% of the light will be transmitted through the lens, only 0.4% will be reflected. So that is better for the night driving and everything. You will not miss the traffic signal, or clarity will increase. Not only the clarity, your appearance or cosmetic appearance also will increase. You can see the compare the with and without coating. So one of the problem with the lens is smudging or oil fingerprint on the lens. For that, you have a hydrophobic coating or water resistant coating is also available for rainy season also. Another problem with the lens is optifob coating. So when you enjoy a tea, hot tea, you can fogging of the lens, or when you come out from the air-conditioned car, there will be fogging. For that, anti-fogging coating also available. And when you go to Himalaya or beach or high ranges or beach, etc., you can have a special lenses that are called polarized lenses available. That is myself traveling to Himalayas. So that the market is available as polarized lenses with a single vision lenses, single vision with the power, progressive polarized lens. Everything is available in the market nowadays. Photochromic polarized lens also available that can change the color, depends upon the intensity of the light. That is ideal for driving also. It is at 10 o'clock, it is at 12 o'clock, it is at 2 o'clock. So a lot of sunglasses available, sports and games, with the power, without power, with the tinting, with the coating, everything is available for different type of games and sports, etc. And polarized 3D lenses are available. That if you want to enjoy the 3D films like My Dear Kuttichatan or Avatar or something, all these lenses are now available. So with the UV protection and the polarized lens, watching TV and everything with a 3-dimensional view. And right spectacle for kids, you should always go for polycarbonate or CR39, never prescribe glasses for children. And there's a separate frames are available for boys and girls. And ideally, you should have a aspheric lenses should be given with the UV protection. And there's you have to motivate the child for use the glass, so you should have a putting on and taking them off. Some training should be given. You can arrange a party with the other children who are using spectacle and everything, and allow the child to select the frame. Then he may use the frame glass also. And for this presbyopic age 40, you can have a separate glasses for distance or near, or you can have a bifocal glasses, but you may miss the intermediate area. Or you can have a progressive lens so that you can have a near distance and intermediate area. So progressive lens, bifocals, you can enjoy the TV and newspaper, but you may miss the coffee or morning coffee. But if you have a progressive lens, you can see the morning coffee also in between. So, but fitting of the progressive lens is very important. The optical center should come to the lower margin of the pupil, and the fitting cross should come to the center of the pupil. And these are the two engraved circles on the lens that will be permanent. If you make a line through these lines, it will pass through the optical center, the lower margin of the pupil. All other lines will disappear after washing. This is a near point correction, and this is additional near point 1.75. So for selection of spectacle is very important for progressive glasses, because the size should be minimum 34 millimeter, and the height should be, the fitting height should be about 18 millimeter. Now with the newer progressive lens, the fitting height can be 40 millimeter also. The problem with the progressive lens is that the distance and the near vision is more clear, intermediate area is very narrow. all these blue or light blue area will be distorted or glare will be there. That's a problem with the progressive lens. Unless you are used to progressive lens, it will be difficult. If you are using bifocal for 10 years, never go for progressive lens. But at the age of 40, you can start with the progressive lens. And depends upon your occupation, hard design, soft design, symmetric, asymmetric, different type of progressive lenses available, depends upon your occupation and everything. So if you have an advanced digital progressive lens, the peripheral distortion will be reduced to some extent, so that you may not miss the football play, the goal, or you may not miss the traffic signal if you are using a advanced digital progressive lens. Of course, the price may go a little high. And when you're fitting a progressive lens, all these measurements are very essential: eye anatomy, ergonomy, face anatomy, wrap angle, pantoscopy, tilt, pupillary, interpupillary distance, back vertex distance, everything should be measured properly. And now computer will help you to follow all these measurements with a software, Visual Office. You can measure all the things with the help of computer, and you put the spectacle with the lens, the computer will mark everything, so the fitting can be very easy. Accurate fitting of progressive lens can be done with the Visual Office software. And this software, you can give the order also to the company. Company take the order, they select the blank, they will do the processing, polishing, laser marking, coating, and finally the finished lens they will send by courier. So only your job is to fit the lens only. And computer vision syndrome is one of the problem with headache and eye strain with the IT people and everything, with the dry eye strain, backache, neck pain, etc. So the treatment for computer vision syndrome or CVS is 3B's approach. So frequent blinking in between, frequent washing of the eyes, take a deep breathing in between, and a break, micro break, mini break, maxi break, etc. in between. When you are going to the toilet or when you are for lunch or tea or anything, you take a break also. So that's called the 3B's approach for computer vision syndrome. As far as spectacle is concerned, ergonomy is also important, with the position, the chair, the sitting, the height, etc. also important. And as far as computer spectacle is concerned, there's a lot of spectacle is available for normal vision spectacle, computer reading glasses, occupational progressive lenses, flip focals, pinhole spectacles, PG magnifier, etc. for computer use. So what is a computer spectacle? It is a multifocal aspheric progressive design for both near and intermediate area. Normal progressive, there is more area for distance and near, but the computer progressive lens, it is more area for intermediate and near area. So all the international brands, KSOS, SLR, Panorama available in the market. And those who are not a presbyopic, younger IT people also, you can have a plus 0.25 diopters. Photochromic UV protected glass can be used. That will be a little relaxation of the accommodation with the UV protection and everything. So any younger people also, you can advise a 0.25 spectacle for computer use with the photochromic coating. And for those who cannot afford this photochromic or computer glasses, you can use clip-on lenses or flip focal lenses. Your ordinary spectacle, you can add on lenses. You can remove at your own convenience, etc. That's very cheap also. So computer use, you can have a ordinary reading glasses, you can have a ordinary bifocal glasses, and you can have your own progressive glasses. But ideally is occupational progressive computer glass, that is little more expensive. And regarding the selection of frame and lens, the market is flooded with all these things. Shell, younger people prefer, and titanium, middle-aged people prefer, and the color, shape, everything vary from option to option. The price tag can be 1,000 rupees to 1 lakh rupees, and Optimed and Safilo is Indian brands. All these international brands, original, Korean, duplicate, China, everything is available in the market. And the sunglasses is flooded with all these glasses, original, duplicate, etc. with the color, shape, everything is different. These are all international brands available in the market. And price can vary from 700 rupees to 1 lakh rupees sunglasses available in the market. And lens material, no lens is manufactured in India. All the lens blank is coming from outside, especially polycarbonate lens, MR 8 and 9, 7, etc. So only things they are doing some final finishing only. SLR and is the Indian brand, other brands, international brands is available in the market. Nowadays, younger generation never go to the optical shop. They purchase glass by online, that's eye browser. Especially Lenskart people and everything, they are doing everything, big business, and they open the shop also in the city for service, etc. So they buy from online purchases now. And if you want to enjoy the music during the driving, especially younger people, there's a sunglass fitted with iPod and everything, with a speaker in the ear and everything, so you can enjoy the music while driving, etc. That is also available. And sunglasses fitted with electronic sunglasses available with MP3 player or Bluetooth enabled with your mobile and etc. So you can enjoy the music while driving, while sports, outdoor games, etc. And those who cannot afford to 45-inch panoramic TV, you can have a spectacle available which can be connected to your mobile, and you can have a pseudo effect of a 45-inch TV screen effect can be done with a spectacle that is very comparatively cheaper than a 45-inch TV. And those who have a habit of sleeping the afternoon class and everything, there's a spectacle available with a sensor fitted to the frame and everything. So as soon as you bend your head or neck, so vibration will come to the ear, so that will awaken you. That type of spectacle also available nowadays. And spectacle is fitted with a lot of the X-ray glasses also available that will penetrate the skin. You can see the artery and vein clearly. That is for medical people, doctors and nurses. And smart spectacle is available. Those who are blind, that it will help you see the obstacles in front of you. A lot of research is going into computer. It is computer chip and everything. So that will help the people to read from the help of computer or write or something like that. So that a lot of research and a lot of things are going to come for blind people. And the Google company is coming with a spectacle connected with the GPS, computer, everything. So you can do, mainly medical people also for angioplasty surgery, etc. That will help. And Luxottica company is coming with a Google Glass that will enable you to watch your WhatsApp or your message or email, etc. with the spectacle and everything connected with your mobile and everything. That type of spectacle also now coming to the market. And the computer is also coming to selection of the spectacle and frame and lenses. The iPod software is available that you can, with the computer and camera, you can have a multiple frame on your face or take your photos. You can share with WhatsApp with your wife who is in Gulf. She will advise which spectacle, which frame is suitable for you because she is paying for you. And the selection of spectacle also important, not only spectacle, the contact lens and the weight of the lens, everything can be computer, you can monitor with the camera and everything. The myopians can see what is appearance and everything. So the fitting of the lens is important. I think Dr. Radharam will talk more about the fitting of the lens and all the problems. I am not going to the details. And all these software you can feed into the computer, and the computer can be connected to the digital edging machine. So the machine will do the rest of the work with the lens, with the edging, surfacing, fusing, grooving, making holes, etc. And your job is only to fit the lens into the frame, so that everything is now machine will do for you. And as far as the conclusion, I should do, spectacles are very personal for every individual. And selection depends upon your lifestyle, your occupation, your visual needs, your taste, and your budget. Of course, how much money you can spend. So any spectacle will cost you anything from 2,000 rupees to 50,000 rupees or 1 lakh rupees nowadays. So that all depends upon your choice. But at least you should have some UV protection, anti-glare protection, and reflection protection is very essential. And nowadays people are going for a branded lens only. So go for branded lens, never go for the Chinese or Korean lens. You always ask for the bill or the guarantee card when you buy a lens and everything, because you are spending too much money for that. As far as doctors are concerned, your prescription should be very correct. Otherwise, the optical shop people will wash their hands and everything. They charge 50,000 rupees and they got 100% profit also. Poor doctor got 150 rupees or 200 rupees, and if your prescription is wrong, all the blame will be on you. So you should be very correct with your prescription also. Our motto is, wearer should see well and look good also. So finally, see better, look better, feel better, and live better. So thank you very much for patient hearing. Thank you.
So thank you, Andrew sir, for that reading class from 100 rupees to whatnot, to 1 lakh plus, including the smart glasses which we are having now for the